How's it going, guys? Past level question for Immuno Step 1 Internal Medicine 2CK. 25-year-old man. He has a 2-day history of pneumonia. And he's had 2 such pneumonias per year for the past decade. And 2 months ago, he had sinusitis. That resolved in antibiotics, deficiency of which the following most likely explanation for the patient's presentation. Should I say? CD40 ligand, wrong fucking answer. This would be for hyper IgM syndrome, which they'll make it very easy on USMLE. They'll give you a big paragraph of some miscellaneous immunodeficiency. They'll say IgM is super high, all of the other immunoglobulins are super low. You're like, well, obviously it's hyper IgM syndrome, and the answer will just be deficiency of CD40 ligand or inability to isotype class switch. So CD40 ligand on the Th2 CD4 plus T cell will bind to CD40 on the B cell, and that will usually enable isotype class switching, which is IgM converting into the other types of immunoglobulins, which we clearly can't do in that case. Wrong fucking answer. Choice B, cell-mediated immunity, wrong fucking answer. This refers to immunity that does not involve antibodies, but that involves T cells still. So in other words, this can be T cells, CD8 plus T cells that are killing intracellular pathogen viruses, also fungi and protozoa that invade. But for fungi, protozoa that are extracellular, you can have T cells secreting cytokines that stimulate macrophages to enhance phagocytosis. So you have T cell mediated immunity that does not involve antibodies. So for USMLE, this can be the answer, deficiency of cell mediated immunity, as per my observation. Notably for chronic mucocutaneous candidiasis, they'll give you a 17-year-old girl who's had candidal skin infection since childhood. She had autoimmune thyroiditis a year ago. She's had a 2-year history of diabetes mellitus type 1. You need to know autoimmune diseases go together. Autoimmune diseases and immunodeficiencies go together. And so answer is just deficiency of cell-mediated immunity. In this case, wrong fucking answer. Choice C, mucosal immunoglobulin deficiency. Correct answer, diagnosis IgA deficiency. So you need to know that most of the time it's going to give you a young adult, high schooler, who's had history of recurrent sinopulmonary infections, pneumonias, sinusitis. I would say 9 out of 10 questions, it'll be a high schooler or older. There's one question on one of the PEDS forms for 2CK where they give it to you in like a 5-year-old, but you're talking rarity, all right? And it contrasts with other more severe immunodeficiencies like Bruton and SCID, which are going to present in very young kids, usually like under the age of 3, okay? So IgA deficiency can also present very similarly to CVID, combined variable immunodeficiency, which will generally be a patient, high schooler or older, who has recurrent sinopulmonary infections. So because they can present on the surface very similarly, for 2CK, the next best step in diagnosis for both of these conditions, IgA deficiency and CVID, is going to be check serum immunoglobulins. And so if they're all decreased, that's going to be CVID. It's inability of B cells to mature into plasma cells, although you have normal B cell number. IgA deficiency, you're clearly just going to see IgA decreased. So in IgA deficiency, you need to know also, apart from recurrent sinopulmonary infections, there's an increased risk of giardial infection for whatever reason they like that on USMLE. There's increased propensity for other autoimmune phenomena. Okay, I just said before, autoimmune diseases, immunodeficiencies go together, but they could give you, I could have said this guy has vitiligo, okay? And very buzzy factoid as far as it can cause anaphylaxis with blood transfusions if you have IgA deficiency. They'll actually only mention that in maybe 1 out of 5 questions. So although very buzzy, it's pretty low yield detail actually. So let's just hop through the others real quick. IL-2 receptor deficiency, wrong fucking answer. X-linked recessive SCID. Also common gamma chain mutation, X-linked recessive SCID, adenosine deaminase deficiency, AR SCID. So it's going to be a sick kid, usually under the age of 3, who has viral, fungal, protozoal, bacterial infections since birth, deficiency of B and T cells. So you're going to have scanty lymph nodes and tonsillar tissue. That's your B cell deficiency. Absent thymic shadow. That's your T cell deficiency. Wrong fucking answer. Choice C, tyrosine kinase deficiency. Wrong fucking answer. Bruton X-linked gamma globulinemia. So Bruton tyrosine kinase, B cell deficiency. 4 out of 5 questions will be a boy who's got bacterial infections only from about 6 months of age. 1 out of 5 questions, they can tell you bacterial infections only since birth, you're like, holy shit, it's from birth. That sounds like SCID. But it's only bacterial infections, whereas SCID is viral, fungal, protozoal, in addition to bacterial. So, wrong fucking answer. You know the deal. I'm to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.